you to this event on our event focusing on violence against women and our Not in My Name campaign. And welcome to our 5 speakers, Joyce Watson, who is a very good friend of the WI and is a member of the Senedd for Mid and West Wales, and who has worked with us on the Not in My Name campaign for a number of years now. Yasmin Khan, the National Advisor for Violence Against Women and Gender-Based Violence, Domestic Abuse and Sexual Violence. Anthea Sully, the Chief Executive of White Ribbon UK. Gwendolyn Stirk, Head of Public Affairs and Communications, and also Jordan Brewer of Policy and Research Officer for Welsh Women's Aid. And once again, we have a good long-standing relationship with Welsh Women's Aid. So welcome to you all, and we will come to you as time goes on. Before I start, I'd like to remind you all to remain muted unless you are invited to speak to ask a question. And to respect everyone's privacy, please could I ask that you do not take any photos during the event. I would like to make you aware that we will be recording the presentations, and these will be sent to you after the event and will be available to access online via MyWI. We will not be recording the question and answer session to protect you, our members' privacy. In terms of the structure, we will hear the contributions of all speakers, and then there will be an opportunity for you to ask questions and to make comments. Please use the chat function if you have a question or comment, and I can see that some people have already done that, so at least it's working. And we will aim to get through as many of the questions that we can during the question and answer session. Following the question and answer, you will be split into breakout groups, or certainly into breakout rooms, which is something new for me on this Zoom situation. And that will give you an opportunity to explore what your WI or federation could get involved with in the Not in My Name campaign and in the wider community action to support survivors and service providers. Ending violence against women has been a long-standing priority for the WI. During COVID-19, our focus has been on communicating to members via social media, our website, and the Public Affairs Bulletin that there is support available to survivors, such as a Live Fear free helpline. And we have also shared resources to support members to continue to support survivors safely, such as the Welsh Women's Aid bystander toolkit, which I'm sure we'll be hearing a little bit more about later on. Since 2012, the NFWI-Wales have been working with Joyce Watson MS in the Not in My Name campaign, which has involved WI members using their links in the community to raise awareness about violence against women and to recruit male ambassadors to pledge their support to ending violence against women. The campaign takes place during the 16 days of activism against gender-based violence, and that starts on the 25th of November and ends on the 10th of December. To give you some examples of what we in Wales have been doing over last year, Powys Brecknock Federation secured the support of Cor Maibion Telgarth Male Voice Choir, Aberhonddu and District Male Choir, and councillors of Brecon Town Council. Ceredigion Federation held a daytime vigil in Aberystwyth, and Custard Queens WI held a similar event in Lampeter. The Federation also raised £350 for 2 local refuges through a street collection and donations from members. Gwent Federation held a light a candle service at St Mary's Church in Usk, and every WI and Anglesey Federation lit a candle in their November meeting. And you can see some of those on the screen today. Some examples of how you can get involved are included in the next slide. Well, the slide that's on the screen now. But I'm sure that we will, following our discussions, we will have very many new ideas and different ideas to come up with. The action pack and other resources, including the PowerPoint presentation, digital story and the poster, are available on MyWI to support your involvement in Not in My Name. In addition, the Public Affairs Department has also developed a number of ideas and resources to support members in taking action during the 16 days of activism as part of the No More Violence Against Women campaign. Examples of the resources include a guide setting out about how to set up a virtual fundraising pub quiz, a tutorial on how to craft a white ribbon, guidance on how to organise a socially distanced candlelight vigil, or how to take part at home, and an educational PowerPoint presentation, which you could show or discuss in one of your virtual meetings. Lots of different ideas there. Over recent years, NFWI-Wales has organised annual events at the Senedd during November to mark International Day for the Elimination of Violence Against Women and the International White Ribbon Day. Sadly, we will not be able to hold a physical event this year, and we will be missing bringing people together on the steps of the Senedd for our candlelight vigil. And indeed, we will miss making those connections where we all get together once a year. However, we are hoping to bring supporters together virtually on the 23rd of November at 6 p.m. So please keep this date free in your diaries. And also on the morning of the 23rd of November, we are planning a stakeholder event focusing on violence against women in rural areas and the additional challenges faced by survivors and service providers. Just to give you another date for your diary, on the 1st of December, the NFWI Public Affairs Department will be hosting a Supporting Survivors webinar. In addition, the NFWI Centre for Training and Personal Development is currently liaising with the National Gallery about hosting a session on the theme of violence against women, covering the topic from a historical aspect. Therefore, there will be many opportunities for you to increase your awareness of violence against women during the months to come. We must continue to raise our voice under the current situation more than ever and challenge violence against women. And I'm now going to ask Joyce, and I know Joyce is in sunny Haverfordwest, to give us the background to the Not in My Name campaign. Joyce, welcome.
As usual, I go off script straight away. The pictures you can see behind me, I bought in Africa when I was asked to speak about trafficking, and they were made by women, for women and children, who were, the funds were then used to help keep children educated and safe, because so many of them had become orphaned because of the AIDS pandemic, and therefore were vulnerable and being trafficked. So that's my bit of piece, my first bit anyway. But I'm really honoured to be asked here today.
Joyce,
I've just realised I'm not very good at technology. What I was trying to tell you, I'll start again, is the pictures behind me I bought in Africa. I was invited there as the speaker on the anti-trafficking, which many of you know I do a lot of work for. And they were made by women to support their families and their children who had were very often orphaned and widowed as a consequence of the AIDS pandemic, and consequently falling victim to traffickers. So that's what the photos are, because most people ask me what they are, so I've told you. But anyway, thank you for inviting me to speak. I do this all the time and I always forget my microphone, so that's not unusual. And as Maya has said, and we've known each other for a very long time, I am a serving member of Mid and West Wales, and it's been 13 years now. With an election looming, it may be another 5, it may not, we wait and see. But I did have life before I was a politician, as some of you have worked out. I'm not 13 years old. And within that life that I had before, I've always fought to improve women's lives one way or the other. I'm proud that as Director of Welsh Women's Voice, I worked with Welsh Women's Aid, the WI, and many others to start the White Ribbon campaign in Wales 18 years ago now, when we had the first Llandaff Cathedral service. And it brought together people of all faiths and none. And it's still going today. And I think that's testament to those people who've kept that going, to bring a diverse group of people together and asking women to walk a mile in her shoes. And that is led by Bowso in Cardiff. When I was elected in 2007, I brought that drive with me and started the White Ribbon campaigning by organising vigils at the Senedd and towns across my region, making and selling white ribbons to raise funds for local women's services right across Wales. And politicians of all parties have supported this pledge, support for the campaign, and they've all given generously to the collections that we've had. In 2008, we recruited retired rugby international Derwyn Jones as our very first male ambassador. The White Ribbon campaign has grown each year, and working with local partners, we've held vigils and events in Carmarthen, in Brecon Cathedral, St David's Cathedral, Aberystwyth and elsewhere. And we've walked by candlelight in all weathers in memory of too many victims of abuse. But it became clear that we could do so much more by working with the WI. And we all know that the WI reaches those parts and those organisations that nobody else can. In 2012, our joint Not in My Name campaign was born, and I believe it's gone from strength to strength. From creative competitions to speaking at WI events, the WI, its staff and members raise the bar every single year. And I must, as always, thank the staff and the members for their tireless energy to achieve this. Themes that have been highlighted include the abuse of older and younger women, same-sex partnerships, the issue of rural, and also the Black, Asian and minority ethnic people. Across the last 8 years, the campaign has recruited most major sporting bodies and clubs in Wales as ambassadors, along with local clubs, choirs and workplaces. Each year we've marked White Ribbon Day with a vigil at the Senedd, and sadly we won't be able to do that this year. But it has been an event where we've had some outstanding speakers and performances, and far too many to actually name individually here today. And as Maya has said, we're in the middle of a pandemic, so we have to move to virtual vigil. And I hope that we will see some exciting plans to take that forward. We do look forward to the days, of course, when we can meet again safely face to face. But we have to seek the opportunities for members from across Wales to participate, and that might be an advantage to some because they won't have to worry about the rain, catching buses, the ability to walk maybe as far as some others could walk. But sadly, and this is the real issue here today, this work on violence against women, sexual abuse and sexual violence is needed now perhaps more than ever. Lockdown did allow abusers to flourish behind closed doors, and Welsh Government's initiative like Live Fear Free is still as necessary today as it was then. Refuge, who run Britain's national domestic violence helpline, logged more than 40,000 calls and contacts in the first 3 months after the March lockdown. Then, when restrictions lifted in early July, they saw a 54% rise in helpline callers needing emergency accommodation compared with the previous week. The Violence Against Women, Domestic Abuse and Sexual Violence Wales Act has been in force for 5 years, with ministers and national advisors, and they're here today, leading a strategy for prevention, protection and support. We all know that we've achieved a huge amount. We all know that we are doing what we can to make women aware, to help them find the information to keep them and their children safe. But the work, unfortunately, will have to continue. And I know that you, all of you who are here today, will do your utmost to make sure that that information, that support is out there in your communities. And I thank you for that.
Thank you very much, Joyce. As you say, we have managed to go from strength to strength over the years that we have been involved together. And I'm sure that this year, although it will not be the same, we will raise the awareness in a very different way. And we will also to a different challenge, to a different audience, and we will raise to the challenge. Those stats with effect of the COVID on us are staggering, but perhaps that is but the tip of the iceberg, and I'm sure that other people today will actually help to give a further information on that. And I have now pleasure in calling on Yasmin Khan, the National Advisor of Violence Against Women, Gender-Based Violence, Domestic Abuse and Sexual Violence, to speak on the impact of COVID on violence against women. Very warm welcome to you, Jasmine.
Thank you. Thank you, everyone. And I'd just like to say it's an absolute pleasure to be asked to come and speak today. I'm really impressed by the work of your federation. I've been involved in many events since my appointment, and I know that you've been absolutely instrumental in many of the campaigns that you are operating across Wales and of course across England and other places. So it's really my pleasure to be here on a Friday afternoon. When we are able to unmute ourselves, I think my family really wish that they had that function in the home environment, because I think more than often they really would prefer if I'm muted as much as I do on calls in the home environment, but that's beside the point. I don't mean to make light of the situation we're in today, far more the seriousness of the situation that we're currently presented in is really testament to the scale of the problem that was never really fully understood, funded, and supported in the way that it should have been. So while we have the one pandemic going on at the moment, there has always been a silent pandemic that has continued in the face of domestic abuse and sexual violence. And I, for one, am really keen to work with partners in Wales. I find Welsh partners and partnerships are extremely passionate, and they have some fantastic services, no more so within the specialist sector. The level of work and commitment has really been upscaled and has really saved lives, in my opinion, in the pandemic. And I can say that with conviction because I also have a charity in England that supports victims of forced marriage, FGM, and honour-based violence. So I fully understand the challenges that the third sector are currently facing. But I'd like to talk about, the victim's journey and what's so important in terms of the impact of COVID on victims. Now, Women's Aid have produced a report called The Perfect Storm. And according to the respondents in the survey, 90% of victims said that their situation had worsened because of from April onwards. So we know that this is something that is really difficult in terms of seeking that first stage of help. And that's where the victim's journey doesn't start, but this need for support sometimes comes with the disclosure and how they are seeking that first level of help. And we know by resourcing the third sector that that's generally where the support sits. We know that victims often self-refer as well as coming through to the police. And certainly what the pandemic has shown is we really need to ensure women in rural communities, women from the BME community, those who are disabled, we really need to do much more to reach out those communities, and especially making sure that the communication is fit for purpose. So it's really important that we work collaboratively to do that. We also know that 1 in 10 survivors told us that their abuser had actively used the lockdown restrictions to stop them from leaving. Because if you look at the situations before, people were going to school, they were dropping their children off, they were going to the shops for some exercise routines. And in the height of the pandemic, this was extremely challenging to reach out for help. And what we found by speaking to specialist agencies, that in fact, the risk of serious violence has also increased in the pandemic. So this is people who are, these are victims who are actually really being seriously harmed. And it's becoming increasingly difficult for them to access the help. And that's why I'm a huge advocate for making sure that wherever victims are presented, that their first response is the response that gets them the help that they need. And we also know with young people, it's been extremely difficult. The increase of online abuse, the lack of engagement with education bodies, not being able to go to schools, not being able to access education, and the risk of the abusers being at home. So it's been extremely difficult to access the support and the information that they need. I think what I'm saying is this really paints a very serious picture of the increased level of incidence that women and children are experiencing in pandemic, the impact that has then on the trauma and the mental health of the people who are experiencing this abuse and this prolonged abuse because of the impact of COVID. Now, when we work with specialist organisations, I don't think we fully appreciated the role they play and the commitment that their staff have in supporting clients and making sure that they're safe and that they, make sure that wherever they're presented, they can receive a safe environment over their heads, whether it's in a refuge or whether it's specialist services. And I also think it's fair to say that just coming into the pandemic, the situation in terms of funding has also almost met crisis level. And we need to do much more to look at sustainable services, because being in a refuge is not necessarily a choice. It's an absolute basic necessity, and it's a fundamental human right. And we need to make sure that refuge services are funded and they are sustainable to provide that lifeline for victims who need to be in that environment. And the impact this has had on specialist services, the staff who provided that non-stop care on evenings and weekends, the impact of secondary trauma on staff working within the sector has been quite profound. And therefore organisations have had to increase the clinical supervision and the support and look at different ways of working to ensure support can be provided wherever the victims present themselves. Now, what we do know in Wales is, you mentioned the Live Fair Free helpline, and this is a lifeline to many victims. And we know that there's been an increase in calls to the helpline, but there hasn't really been evidence in terms of the increase in the calls in comparison to the increase in referrals. And what we found is women who are contacting the Live Bear Free helpline really are continuing to help in different, are continue to seek help in different ways. For example, the silent 55. So if you need help, the silent 65 calls to the Live Bear Free helpline are 5% or 6% higher than the same period between February to September last year. So the Welsh Government, along with the key stakeholders, is doing what they can to increase that communications in various ways. And that has to continue, especially as we've come in through to a next phase of lockdown restrictions. And although the Live Bear helpline doesn't have the information we need for the demographic breakdown of callers in some instances, what we do know is that the calls to the helpline have become more complex and higher risk. Now, what does that actually translate to? What that translates to is there needs to be more intensive support for victims who are showing those signs where those, they've been experienced abuse for much longer periods. So the levels of abuse have risen in terms of serious violence. And therefore, when they are calling for and getting the help that they need, what happens is those are very complex needs. There are children involved. The trauma has been long sustained trauma. So immediately we need to look at the refuge accommodation and the housing needs. Then they also need to be supported in terms of the work that they help them recover. And again, I think this is where the role of the third sector is absolutely essential. The aftercare that is provided after the initial work is done to support them and get them the emergency care that they need, keeping out of violence, keeping them supported, making sure they're resilient, they can start to build their lives, is where that crucial stage and support is absolutely imperative. And it has to be said, this is where the third sector really pick up the piece of that jigsaw. One of the survivors I spoke to said to me that in Wales, when she initially reported the abuse, she received the level of support and the care that she needed. But when the realization of the impact of the abuse kicked in a couple of months after, when she was in a safe environment and she was free from the abuse, she said it was like a bereavement. That is when I needed the support. That's when I felt I was at my lowest, and I suddenly realized the long journey ahead of me. And this is why third sector organizations are vital in building the capacity of survivors, helping with recovery tools to keep them out of violence and making sure that they can be supported on their onward journey. So in terms of what the Welsh Government are doing, they've just produced a guidance for what services can be supported in through the pandemic. I've also been working with commissioners in Wales to looking at a sustainable funding model, because ultimately services need to be supported. And as we are seeing an increase in referrals, the demand on services are extremely serious. So as I mentioned before, starting just before the pandemic, funding was also at a critical stage. So what we're trying to do in Wales with partners, with commissioners, is to set up a separate commissioners group so that we can actually start to align the needs for services and the gaps for services and ensure collectively we can look at longer term funding. As I've worked with the ministers and the government in looking at ways to bring in more money into the sector, in some cases, and this has been very challenging because a comprehensive spending review has been delayed, and this pandemic has taken over almost every major policy priority. But that is an onward battle, because there does need to be, after a pandemic, after the restrictions have been lifted, that sustainable model which ensures those services are there for women and children who need support. I'm also picking up a piece of work for migrant women who are, because of their situation and because of their status, are being denied access in some cases for safe accommodation. So I'm working with a small group who've picked up a report that was done a few years ago called the Uncharted Territory. And we really want to focus on working with the honour-based abuse leadership group across Wales, so there's a better understanding of the increase of referrals coming in from forced marriage, FGM, and honour-based violence. We've just had some statistics from the Carmen Urbana helpline, which have reported for Wales specifically 32 cases since the period between September to April 2020. And since lockdown, there's been 14 more cases in comparison to last year, so a 42% increase. We know that we have to work with education partners, because where young people are not accessing the help that they would do through their welfare or safeguarding officers within those schools or further education, we need to do more. And that's why there has been a separate group that has been set up to look at these challenges, particular challenges for young people. Both Nazira and I, who's my counterpart as a national advisor, have almost understood the need for us to have a better understanding for services who support victims of sexual abuse and sexual violence. We've heard for some time, even before the pandemic, that there are particularly a higher increase in referrals and thereby an increase in demand for the counselling and therapeutic services. So both Nazir and I have asked sexual violence providers and Women's Aid in Wales to provide a strengths and weakness analysis, and we're just at the cusp of putting some findings together. And it's just to validate what we thought in terms of the rate of increase in services for sexual violence support hasn't matched the funding that's coming to the sector. So that's something that we're particularly picking up. You mentioned prevention, protection and support, and also the Welsh Government have done some excellent work around perpetrators, because this level of abuse, we have to engage all of the sectors, and we have to also engage the perpetrators around challenging the offender behaviour. And also in Wales, one of the things that I'm really pleased to be involved in is, before the pandemic, we started to look at the South Wales police model, which was exploring a public health approach to Bowder SV. And what we mean by that, as you have with track and trace now, with the pandemic, we want to have a better understanding about the root causes of violence against women, domestic abuse and sexual violence. And that will mean, as you have with an outbreak, looking at where the original outbreak occurred. Where did the situation where did we find out about the situation? Was it a child who went to school? And we can put together the pieces of the victim's journey to ensure that we have a much better understanding of the extent of the abuse, the nature of abuse, and the impact of violence against women, domestic abuse and sexual violence across Wales. I feel that in Wales, we are working well with key stakeholders, and as such, we're meeting regularly with all the key stakeholders through our Bowder SV COVID group, which we have agreed to continue working with, as we're seeing real value of the information that we're receiving, and also some of the partnership approaches that we're looking to develop. We're also looking to work with the critical information we're receiving through the court system in terms of the backlog of cases and how special measures need to be upheld when victims are receiving the support through the criminal justice system. And of course, we have on the horizon the new legislation, which will be having its second reading in November, which really looks at domestic abuse and ensuring that victims can be supported. So I'm looking forward to continuing working with Welsh partners, because there's no single agency that can understand fully and support victims alone. But we have a much better picture of the scale of the problem, the levels of abuse and the impact of COVID for survivors, and making sure that their voices are heard through the various ways through survivor groups, through referrals, and making sure that we can actually learn from the mistakes that have been made so that we can continue to provide the right level of support and at the right stage when they come into. And one of the key things I've been hearing is because of COVID, survivors are navigating their way through services. That's simply not good enough. We need to reach out to those survivors who need our support, and the brilliant work of this third sector who are actually saving lives. That's what they're doing. They're actually saving lives of survivors, and we need to work collaboratively. So if there's any programs or any events that you want me to be part of, I'll be more than happy to be part, because we cannot deal with this issue alone. This is not something, unfortunately, that's going away now, certainly not in my generation. And that's why it's important that we use this opportunity to make sure we make the changes sustainable and support as many victims wherever they come through. Thank you.
Thank you very much, Yasmin. I'm sure that you have given us many, many things to think about, and that will give us an opportunity to talk about too later on. I do think it is vitally important that we look at things in a holistic way. The pity is that when we're talking about COVID, it has brought about a difference here in that people are confined in their homes and therefore sometimes cannot get out at all. But having said that, we are all working together, and I'm sure we will help to do that. It seems a pity that COVID has brought about and perhaps has highlighted in many different areas the fact that we all have to work in a different way. So perhaps there will be many positives from that. So thank you. We'll take on the discussion at a later date. And now I'm going to move on to Anthea Sully, the Chief Executive of White Ribbon UK, who is going to talk to us about engaging men and boys in ending violence against women and the work of the White Ribbon campaign in its entirety. Thank you ever so much, Anthea. Nice to see you.
I'm going to try and share some slides. It's always very nervous whether this is ever going to work for me. Oh, it's looking like it is actually.
Yes.
That's a good start. Now I have to find slideshow. Here we go. And everyone can see all this and is waiting for it to happen, aren't they? There we go. I'm going to show some slides because hopefully that'll help me be a bit more succinct, but you never know. Might just talk too much anyway. Thank you very much for inviting me today. It's always fantastically encouraging to encounter again the work of the WI in Wales and Joyce. You managed to achieve so much in terms of reach and changing people's lives, and also really importantly recognizing, remembering and holding the names of women. There's far too many women that have been lost, and that's something that White Ribbon UK holds very closely to our heart in terms of making sure there's a true legacy and working towards the end of violence. So, I wasn't expecting that to happen. There we go. I've got animations running. So just to summarise what we want to do, we want all men to understand and promise this, the White Ribbon promise, to never commit, excuse or remain silent about male violence against women. We want them to consider their own behaviour and think about the behaviour of others. So think about their own actions directly, but also about the actions of others. So not turning away, not making excuses for behaviour, and speaking out. And that's what we expect of all men. And our work is focused around that seemingly simple commitment. And the really essential thing is to make sure that men, when they're making that promise, really think about what that means. So there is a cost for them in taking that on board. I thought I'd just briefly introduce what our ambassadors say. So these are men who have come through various means. Some have volunteered independently, some come through organisations, and they are men who are wanting to lead the way in terms of standing up against violence, acting as role models amongst their friends. So this is what 4 of them say. We need to recognise male violence against women as a man's issue, and that the responsibility for ending it should rest primarily with men. It's basically about empowering men to not be bystanders to domestic abuse, and to empower men to become ambassadors for the cause. When relationships are based on equality and respect, everybody gains. And I think we should celebrate positive role modelling. Just on that last point, talking to some of our ambassadors just as we came out of lockdown, we looked around for during the time of COVID and where there had been examples of positive role modelling, and that was a real struggle to find that, and it was something that we felt should be looked at. There was also an issue where we found examples such as men helping with childcare or educating children at school. They were held up as being exceptional heroes, whereas of course the majority of that kind of support was falling on women. So it shouldn't be that men are exceptional. It should be expected that they would be supporting and taking part in that way, and that contradictory messaging was something that we identified as really problematic and needed to be learned from. So just some of the things that have been features of men's behaviour during COVID. Much of these figures and issues have been taken from the report by Dr. Stephen Burrell from Durham University. I've headed this, however, no excuse for abuse, which was one of the hashtags that we were using, many organisations were using. And it is really important in saying what the pressures were on men during COVID, that there is absolutely no excuse for that to lead to abuse. And that heading is important before I go down these points. Masculinity and gender masculine stereotypes tend to promote risk-taking among men much more than and risky behaviour much more so than women. It's fairly evident that means that men have been often taking the lockdown and social distancing rules much less seriously. And that's therefore put people and women that they live with, as well as other people, at risk. There's also been some by issues of the pandemic. So the roads have been quieter. So that's seen an increase in speeding and dangerous driving because the roads have been quieter. So activities that men will often engage in have also increased. There's been an increase in addictive and harmful behaviours, gambling, alcohol and drugs. They can factor into violent behaviour. Masculine norms may have discouraged men from reaching out to their friends and their family or community members if facing difficulty or loneliness, and that can end up being problematic. There's been a real difference between male leaders internationally and nationally and women leaders. And many of the male leaders during this time have used warlike language, have used quite violent fighting language. That's been very macho in terms of how they're approached. And if you want to, we could contrast that with the approach of somebody such as Jacinda Ardern and the way that she's managed that. So the leading men that we have seen during this time have been very often, not exclusively, but very often promoting this very specific type of masculinity that is then problematic. We've already heard, and I won't give any more information, but perpetrators of domestic abuse who were already there have used the pandemic to increase what they could do to contain women in their homes to further isolate them. So the abuse that was already there, they have found ways to make that, to increase the abuse that they've been able to inflict on women. And then other violence against women has also increased. So there's been an increase in online abuse through many forums. And just something that I found astonishing, 19% of girls and women aged 14 to 31 in the UK reported experiencing more street harassment during lockdown. So out on the streets, it's thought that's because there's been fewer people around. So men have felt that they were able to, without any concern about redress, be able to harass and abuse women because there were less people around. So the issues of male violence are widespread and not only in terms of the huge increase in issues of domestic abuse. So it's a very concerning situation. So against that, and how we've been trying to work as White Ribbon, we've been really challenged. The ways that we work are finding men where they are. So we work through sports clubs and workplaces, pubs and clubs, universities, places where men congregate, and we have our ambassadors talking to their friends, meeting with their friends where they meet them and their colleagues. That's not been happening in the same way, if at all. So we've been very challenged by that. Where we're working through the large number of organisations who support our work and the ambassadors within that, and also the very many women who are supporting our work through that time. Many people have been furloughed, so we haven't been able to contact people. So we've been hoping that people have been exercising their role as ambassadors, acting as role models amongst their friends, but that we haven't been able to directly contact them. So organisations that work with us have also been incredibly stretched through that time. And the other thing that's been absolutely pressing is that the attention has rightly and importantly, and the need for funding has had to be on frontline support, and there still is not enough for that, and that still needs more attention, and we need to be extremely careful as an organisation that we're not in any way taking away from that urgent need. So how we work has been very challenged by the current situation. And yet the work is really important because we have to engage with men and boys to change behaviour, and so to prevent violence and to prevent violence in the future. So we have to find ways that we can do that. So gradually, as we've been coming out of lockdown, though I'm speaking to you from Manchester and we've been back in a sort of lockdown for quite a few weeks now, but we're having a lot of interest and people are bringing their creativity to this situation, both individuals and organisations, and hearing about what you're doing in Wales to make that, to raise awareness and to make things happen is really encouraging. So we are developing resources online, we and others are doing so as well. Sports clubs are getting involved, and just because you can't have people at certainly higher level sports events, there's a very big television audience there. We're working and encouraging the press and media to promote positive stories about how men can take action, how men can behave. We're developing online training, and the 25th of November itself, people are creating outdoor events. They've got online quizzes, work in schools, which at the moment we're hoping will be open, is happening. There's information going into shops and places where people are able to be. We've got an increased number of Christmas decoration, white ribbons, lights on buildings, so getting the message out. And I just spoke to somebody a couple of days ago where they have decided they're anticipating that barbers will stay open, and they are getting every single barbers in the city are going to have a poster about making the promise. So that's our drive, is to make sure that we get the message out. We find places where we can challenge men's behaviour and get men to challenge their own behaviour and that of their friends to speak. And it's an ongoing process. We're finding ways of being in the new reality, and that of course is changing all the time. And we need to find ways of doing that always at the forefront are supporting frontline work and ensuring that the people who absolutely need help are getting that. And I absolutely commit that however much we're wanting to do preventative work, we will not lose sight of the immediate need. And I think that's my last slide, apart from our logo. Thank you very much. It's been great to talk to everybody. It's lovely to be with such a large group of women. Thank you.
Yeah, thank you ever so much, Anthea. And certainly it's up to us now to take on board that message about never committing, excusing, or remaining silent about domestic or male violence against women, and to make sure that all our friends realise where that comes from, and make sure that we all take it on board in our wider communities as well. I have to say it was very interesting to note something that I hadn't thought about was the harassment of women in quieter streets. But when you think about it and it's brought to your attention, that certainly raises an issue for us all to consider. But thank you ever so much indeed. And our next speakers and our last speakers before we have our question and answer session, it's about violence against women is everybody's business, and the role of communities in taking action to support survivors and service providers. And once again, we welcome Gwendolyn Stirk and Jordan Brewer of Welsh Women's Aid. Croeso chi gyd. Welcome.
Hi, thanks for having us here. We've also got a presentation, so I'm just going to put that up now. Can everyone see that?
No, Jordan.
No.
Oh, the wonders of technology, isn't it?
I'm getting an error message. That's not good.
Do you want me to try, Jordan?
If you don't mind.
Too many things open.
Not looking.
Is that working from me?
Yes, that's
Yes,
better.
that's working.
That's it. Lovely.
Okay, I will try and get, same situation where I'm trying to open it up as a slideshow. But Jordan, if you want to start, and I'll
Yeah, no problem. So yeah, thank you. Welsh Women's Aid are really pleased to be here today, and I found the first half of the event really interesting and useful, so thank you to all the speakers before as well. So I'm Jordan Brewer. I'm Policy and Research Officer at Welsh Women's Aid, and I'll be taking you through an overview of the impact that COVID's had on survivors, on our members and on communities. Then I'll hand over to Gwendolyn Stark, who is Head of Public Affairs and Communications, to tell you about our Stand With Survivors campaign, the Bystanders Toolkit, and how you can get involved. So to start, the next slide, please. Thank you. These are some of the initial impacts that we've seen from COVID. As you can see, there were over 12,000 contacts to the Live Fear Free helpline during the first half of the year, a 70% increase in contacts by concerned others, and this was following the publication of our Bystander Toolkit. There's been a complexity of cases reported has been significantly increased, and this has led to the average of calls durations doubling since March. 266 children and young people were supported through refuge-based support. However, specialist services have also reported a drop in the number of children that they could support in the community due to lockdown restrictions. And lastly, 6 out of 8 specialist services have expected there to be a surge in further demand as lockdown continues and as certain lockdown restrictions ease. Thank you. So what does this mean for communities? As I previously mentioned, there's been an increase on calls to the Live Fear Free helpline from friends, family and neighbours, and a prevalence and impact of domestic abuse, which has been highlighted to the public through various media stories, which has been raising awareness of the issue. But what has also been highlighted is that routes to support and help have not been it's not well publicised and known. What to do if you were a concerned friend, family or neighbour, and areas around safeguarding is not well understood, and indicators of abuse and by perpetrator or effect of trauma on survivors is also not well understood. As well as this, there's a continued prevalence of myths and stereotypes. And I'll hand you over to Gwendolyn now to take you through our approach.
So it's been a year since I spoke to, almost a year since I spoke to you at the Senedd about our Ask Me project as part of our Change at Last project, about how communities can engage. And I think that day we had a workshop about all of the different ideas of what we can do in the communities. And basically, when COVID happened, within the first couple of days, we got together across the teams and were like, right, how can we take that learning that we've had from a couple of years of delivering that project in communities, both in rural communities and in cities across Wales, and transfer it into a world where we can't, talk to somebody in a hairdresser's, can't talk to somebody in your local shop. We don't have those contacts with each other across the communities. How can we redo it? And we really redesigned our campaigns to really focus across these sort of 3 areas of campaigning. So, taking that learning, raising awareness of where the help is, making sure that that was a visible thing across communities in Wales, and that people knew that the helpline was still open and the support services were still there and are still there. Making sure that everybody in the community had some understanding of this being their business and what they could do. I think we saw a great surge in community engagement and involvement at the beginning of lockdown, but we had also a lot of those myths and misunderstandings, not knowing what to do and perhaps trying to adopt activities that could have potentially put people at risk. So we really wanted to get out, how can you safely signpost somebody to support, so making sure that that's done in an appropriate way and that wouldn't put them at further risk, and making sure that also the information was particularly the correct information for Wales on the ground, and linking in with those local services that were still running in the communities. And then also making sure that that information went out to survivors, not just survivors that are currently sitting within the situation of abuse and violence, but also there is a lot of people that have survived abuse out there. The isolation and social distancing is really triggering. It cuts off your contact with your usual support networks. There's a lot of people sitting there with mental health concerns with around this, and what could we provide as support around that. And we've been continuing this campaign and developing it throughout the last lockdown, throughout the summer as things changed and things opened up, targeting various things, but also through now going into the local lockdowns as well and adapting it to that. So what we produced, and it's really, really welcome to hear that it's been shared with you. And as I say, it keeps changing, so keep going back and using it. So it's on our website, and we're happy for these slides to be shared as well. So these are all links that you can use. So we've produced some of that sort of information about what to do, what not to do. a whole resource. We've got now a whole collected resource for survivors around local lockdowns and what they can, things that can help them, including a card that they can carry to say that they're not able to wear a mask if they do not feel able to wear a mask, because it can be quite a triggering thing for many survivors to have something placed over their mouths. So we've produced a card that can be downloaded on our website that just says, I've got trauma experiences, I'm excused, I have a reasonable excuse not to wear a mask, so that they don't have to get into a long explanation every time they get on a bus or go into a shop. As we said, we've provided information for friends and family. We've got this in English and Welsh, and we've also got it in Polish, which is the one of the most prevalent languages, second languages spoken in Wales. We've produced a whole list of useful numbers. So there's obviously the Live Fear Free helpline, but there are localized services, there are specialized services, so services like BAWSO, which particularly works with Black and minoritized women, and other services, so that make sure that all of those services are there and people know that they're there and still working. And then specific information for different areas. So one of the things, people are still at work, we're just working differently. I'm zooming into people's lives every day, you know what I mean? I'm in their homes, as managers, we still have a responsibility to support our employees, regardless of whether they're in our offices or not. And we need to make sure that that guidance is there for them. And similarly around volunteers and volunteering, we know that people have been going out taking food packages and things like that. They needed to know what they did to do if they saw somebody disclosed to them, or there was a survivor, they had a survivor. And similarly also journalists, we really were keen to making sure that journalists got the message out, but got the right messages out, making sure that there's no victim blaming messages within what they were saying, or didn't blame COVID. This is not something that's happened during COVID, it's something that's put a barrier up to the work that we're doing. But violence against women has unfortunately been with us for a very long time, and we still needed journalists to recognise, as the previous speaker spoke about, where the blame for violence against women lies, and that's with the men that commit the violence and abuse. We also then realised that, from what Jordan said, that the services were having particular issues reaching out to children and young people in the community. We knew that they were at home, they wouldn't have been getting the usual healthy relationships in contact, education contact with teachers and in other spaces. And so we created a group of fact sheets for children and young people that specifically talked about issues that would affect them. So, and we know a number of them where they're developing new relationships and interacting online. So we provided a fact sheet around that. We also saw somewhat of an increase around young people that were perpetrating abuse to family members, including parents. So we put a couple of bit of information around that out, and then specific ones around FGM and forced marriage, and these have been translated into quite a number of languages, so they're accessible. And we're going back to school now. What we've done is work with the Welsh Government and with BAWSO and with the ACES Hub to provide similar fact sheets to teachers, so that when the children go back and may disclose what they've been experiencing at home during this time, the teachers, have some basic information about what forms of abuse these children might be experiencing, and maybe can spot the signs, but also know how to deal with the disclosure. And again, know that referral route to that local service, know who they can offer, the child to access support with, but also for the teacher to know that they've got a local expert in their community that they can call up and say, I think I've got a situation, what do I do? So that creating those links within the communities. Wider, Yasmin's been speaking, we've been very much working, trying to align all of this with what's going on a national basis. So aligning with Welsh Government's campaign, Home is Not Always a Safe Space, and also the Home Office campaigning. Sharing a lot of information. One of the benefits that I think that's really come out of COVID is we've seen agencies come together, really seeing that this is a priority area that we need to deal with, and bringing together that information and data to see what the situation is and problem solve around it. So we've been working very closely with Public Health Wales, for example, and the Violence Prevention Unit to map data, to look at what the situation is. And we held a conference in July, an online conference, looking at sort of what's the data telling us now? What can we predict is going to happen in the future? Because we know that this is predictable, and how can we plan for that? How can we know that next time we have a pandemic, which is potential, we have actually put in prevention and early intervention, that we don't see the spikes that we see now. As already has been said, I was really pleased to hear about within my presentation at the beginning that there'd been some donations happening to local services in communities. They have been really struggling regarding funding during this time. We have had emergency funding coming in from Welsh Government, from trusts and foundations, and from UK Government, but 100% of services said they've had additional costs, but also 41% said they've lost some form of funding during this time, mainly through fundraising activities, which they rely on to sustain themselves. So it's really, if there are opportunities, and if we can help in any way to link up with activities to your local services, I think we'd be very keen to have conversations around that, particularly as the emergency funding only goes up the 31st of March next year. And with all of the local lockdowns happening now, we know, and the impact, the long-term impact that violence and abuse has on women, we know that we're going to need support, significant more support beyond March next year, going forward. So these are the kind of actions that we have set forward. So we're sort of splitting them into, like, there's immediate actions that we need to do now in the short term. We're back in local lockdowns. I think most people in Wales are under some form of lockdown or restrictions. Now, it's about utilising the tools that are available, making sure that communities are widely campaigning on these issues, making sure if we're in positions where we are considering making those changes and putting together those restrictions, that any of the interventions that we do don't have a negative impact on that earlier intervention with survivors. So, for example, we know that GPs and A&E services, for example, are often now accessed through the phone rather than somebody going in person. What does that mean for a survivor? Would that have been a space where, if they'd been on their own, they would have been able to disclose, where they're not able to do on the phone? Or in some cases, we know, for example, on the phone for some sexual violence survivors has enabled them to disclose, because they don't have perhaps the same ideas of shame that they may have had in a room. So it's about thinking about what that means and what it means for different cohorts as well. Our frontline staff have been working really hard, but they've also been impacted by social distancing, and we've had significant increases of those that have been off work because they are either caring for somebody who's self-isolating, or they are self-isolating themselves. All of our workers are women. Most of them have childcare issues, and have been significantly impacted by this. While they were seen as care workers, many of them still struggle to get childcare during this time, and it's not appropriate for them to provide support with children in the background. So we really need to make sure that they have access to childcare, that they have early access. I know that one of our services has written to Gethin recently to say that they really need to have access to vaccines as soon as they come out, to make sure that we can keep the refuges open and that we don't end up being understaffed. Medium and long term, we're going to be campaigning obviously for that sustainability of services going forward. We know that the Welsh government budget is coming up, and we need that, this to be considered within the Welsh government budget, and we will be producing our state of the sector report outlining a sustainable funding model for Wales going forward. And similarly, we have a clear manifesto coming out that sets that forward for the elections, because we're aware that this budget is being set, but there are elections next May. So we need all parties to be committing to making sure that those specialist services are there. They're there for children and young people, and they're there for all survivors. So again, we welcome the Welsh Government extending support for survivors and no recourse to public funds. That has led to an increase of women being able to come into service, which is fantastic. But what happens when that emergency funding ends? What is the cliff edge that we will be falling over at that point? And so we really welcome the support of the WI and all of the support that you've been doing over many, many years. And we hope that we can continue to work in partnership, both to raise awareness within communities, but also to support the services that are providing this vital support. Thank you very much.
That it was such a quick whiz through the issues and the topics that we wanted the questions to consider. So can I go through each of the groups? Who's going to start? I don't know who the leaders of the groups were. So will somebody please volunteer?
It's
Rhiannon? Oh, sorry, I'll ask Rhiannon first, sorry.
Hiya. We just had a very quick conversation. We went off piece a bit because we were struck by Gwen's the quote in Gwen's presentation about the routes to support were not well publicised and known, and we discussed what we could do to change that. And Joyce said, we need to look at if women during lockdown, if the partners let these women out for any reason, to look at where they went. So they possibly went to the pharmacy, they possibly went to the local supermarket. Maybe they went to the hairdressers. So look at where, the women are going and flood those places with the information that they would need, the helplines, where they could turn to for help. Maybe print something on a till roll, if you could get the supermarkets to put like numbers on a till roll so that they could keep that and they'd have the number to hand. And then Geraldine mentioned that the Soroptimists had done something similar, and she's a Soroptimist as well as a WI member, and how they've also got information out there. So we all felt as a WI network, we could do that, something that we could do. Oh, that's great. Tesco's have already got it on there, yeah. So that's great. So looking at where the women go and get the information out so that we can, spread the word and know that women know who to turn to for help. That's as far as we got.
Thanks, Rhiannon. Who's next?
I can go next, Maya.
Yeah, go on then, Sarah.
Yes, similar to what Rhiannon was saying, our group looked at, about the need for creative messaging in reaching women, in their communities. Also, some of the issues that WI members raised was knowing really where to start. There's so much information out there. Some members wanted to learn more about the situation and to look at ways of taking the campaign forward. They recognise it's a huge area of concern and anything, but they want to know more and maybe access to more resources so they can actually, take practical action in their communities. And Pembrokeshire Federation mentioned some of the activities they've done in the past, working with Hafan Cymru around International Women's Day. And other events as well, and they've got good links with the local refugees, but they said again maybe there's more they can do to strengthen those links as well.
Okay, anything else? Right, who's the next person then?
Do you want me to go next, Mar?
Yes, please, Dan. Diolch yn fawr ti.
Okay. Our group was, well, we did go off track a little as well, as I think everybody did on this one. But we had a good discussion, and we really liked the point about barbers. It isn't something that we've targeted before, and leaving leaflets and posters there was something that we felt could be quite a positive. And really environment where men were on their own together, so possibly in some pubs, and to join with other organisations like the Rotary, who have a network going out all over the place. To use social media and whatever WhatsApp groups or messengers or FaceTime or whatever groups we belong to share the message, and obviously use posters and leaflets, and in a controlled way within COVID, whatever lockdown allows us, to still do our vigils, etc., but do it in a way that isn't breaking any rules and regulations during current lockdown. Then we went on to the last question, which was how do we get women to talk about it and to ask for help? And we were very concerned that we have to get rid of the taboo behind this and to make it easy for women to talk about it and to talk about the statistics that we've heard about today, and just keep mentioning it and keep mentioning where they can get help without actually pointing a finger to anybody, but just to direct them towards help. So it was very interesting, but we could have done with hours more time.
Yes, I think we could have, but on the other hand, we've been stimulated by having the initial speakers to start with, and that's how it goes. Okay, who's next?
Jill Rundle, can I go next?
Yes,
Please?
Jill, yes, please.
Okay, yeah, we were chatting as fast as we possibly could. On question 1, we were looking at innovative ways that we've noticed during lockdown. One was to get the helpline number on milk bottles. Certainly we'd seen some at Tesco on the till rolls, and also I'd seen them in my bank, which was offering, if you were on your own and pushed, you could actually speak to a cashier and they would take you into the other room and get you in contact with the helpline, etc. What can WIs do? It's about, keeping it on the agenda, keep talking about it, but one area they had reached out to men's organisations in the rural areas, and also under that point a really important point was made that some of our members, some of our older members, maybe don't actually recognise what abuse in its entirety looks like. They don't understand coercive control. They think it's perhaps something that they've grown up with and accepted. Well, this is just my husband looking after me, not allowing me to drive or not allowing me to go anywhere or whatever. That's what you expect from a husband. Number 3, it's still all about keeping talking and posters, and maybe in ladies' loos where men don't have sight of the helpline number, because certainly on the milk bottles, I mean, they will have seen the number, and if it appears on the list of numbers called, then they're going to be alerted to that. Social media, ensuring that it was on social media. Also, there was a question about not realising there were groups for perpetrators, and wanted to know more about what went on at perpetrator sessions and how they dealt with perpetrators and how they helped and supported them. We didn't have time to go to number 4, I'm afraid, but that's the basis of what was said in my group.
Thank you ever so much, Jill. Right, the next one.
Yeah, I think we may be lost. Sorry, Matt.
No, you've got another one to go.
Okay.
According to me, this is number 5.
Bring home bad to everyone. We had a great conversation, and what we found was that potentially there were some difficulties in engaging members, WR members, but one route would be to include donation drives in newsletters. That seemed to work quite well. We know that members were quite passionate about marching when we were able to march, so it's trying to gather that same momentum really into activities that will have to be online. So I know that Gwendolyn mentioned that normal fundraising activities, a lot of them unfortunately have been cancelled, which has had a massive effect on refugees. So perhaps looking at changing that engagement and putting that momentum into online events. And really, I think there's the issue of still trying to tackle the taboo of the subject. It's still, we've heard back from members who are still quite reluctant to engage in the topic, as there's still quite stigma around the discussion. So some really great discussions and certainly some good feedback for myself to take away and put into our plans of work. So thank you.
Okay, you probably picked up some tips for the 1st of December, I think, Anshel. So
Yes, thank you.
But thank you ever so much for that. And the last but not least is Lisa Howells, who's not.
That was our group.
Yes, our group.
Yeah, I think most of it's been said already, to be honest, tapping into sort of social media routes, maybe getting into the curriculum at schools very early on and speaking to teachers are there with our children, every day, and they become good at recognising signs. And we said about when society opens back up, continuing with the walks, the vigils. I work a lot with Dyfed Powys Police, getting into them, giving them presentations, because a lot of the time they're just going from A to B. They don't really know. Training is quite limited with a lot of police officers, and they're just expected to know, you know, so tapping into their training routes. And interesting, somebody said earlier about going around the barbers and hairdressers. I am that girl. I did it a couple of weeks ago. I went to Lampeter, Newcastle Emlyn, with my leaflets, and I was the one that puts them on the back of toilets, went into nail salons and hairdressers and put my leaflets up, places where I would expect ladies who need help to be, and they've got that information in front of them. Yeah.
We did also talk about sort of thinking about perhaps not the not so obvious ones of dentists and opticians and those places as well, where perhaps people aren't as you know, we don't think of as much, but people do go in and out of them, those places as well. Okay, well, thank you ever so much indeed to everybody. Can I say I have a feeling that Respect UK is going to have an awful lot of access, as is Welsh Women's Aid. Can I ask Gwendolyn? Gwendolyn, do you have a leaflet on your website that people can use? Gwendolyn's not with us anymore, perhaps?
Hi, sorry, I can step in on that one. Jordan from Welsh Women's Aid.
Yeah, thank you.
We have the bystander toolkit on our website. If you just type in Welsh Women's Aid bystander toolkit, it should come up on Google, and I'll send it over to Sarah as well to circulate to any of the members today as well who are interested.
Lovely, thank you very much. And of course, as we work towards the November timescale, perhaps it might be worth asking your organisations with large buildings like your county halls and various other places, if you can light up your county hall with the appropriate symbols, do you know what I mean? So that makes people ask at least, and it's something that we can do. I know it's on Carmarthenshire's list for things to do for County Hall. I'm not absolutely sure about Llanelli. I have to check on that one. But there's certainly on there. So there's lots and lots of things that we could do. And I think perhaps, and I have to apologise that we were restricted in the discussion time. That's where the networking always takes all the, where we all learn bits from everybody, isn't it? And it's that discussion. So perhaps next time we will have more of a discussion, and then we'll get everybody to be part of the whole session. But we are coming to the end of the session. I mean, and thank you all for staying on. And I hope that we'll see you all in November. But thank you for joining us this afternoon. And in particular, can I thank Yasmin, Gwendolyn, Jordan, Anthea and Joyce, who are our great supporters wherever we are. And we do hope that you and your WI will get involved and take action during the 16 days of activism, and take into consideration that lockdown restrictions and social distancing. But having said that, we do have the ability, and we also have the ingenuity to think outside the box and make sure that we can bring this to people's awareness. Violence against women is a cause and a consequence of gender inequality, and we all have a part to play in this, in challenging the attitudes and behaviours that lead to violence against women, be it at home, in the community or in the workplace. But do please visit MyWI and access both the Not in My Name and the No More Violence Against Women resources. I'm sure you will find it all very, very interesting if you haven't already been in there and looked. But during the coming days, the link will be shared with you to access the presentations, and we'll also provide you with the summary of the ideas that we've raised in the breakout groups. I hope that you've enjoyed being with us, and sorry that it's been a little bit longer but curtailed in some other places. But diolch yn fawr iawn i chi, thank you very much indeed, and hopefully we'll see you all in November. Diolch yn fawr, thank you.